What do I do about patients who are seeing so many healthcare providers at the same time that they already feel overwhelmed with what they're doing? They don't want to take any more recommendations from me. Well, first of all, I hate to state the obvious here, but they're in your office or they're knocking on your door for your online help. You know, like when I get people applying for Modern Vitality coming in, they usually have seen some other practitioners. They're usually doing some kind of functional medicine, naturopathic thing. They're probably on some meds from their MD. Oftentimes they've had acupuncture before, they've done Chinese herbs before, they kind of think they have, and it's up to me to educate them on what's different here. So it's very, very rare you're going to get some patient who isn't seeing any other provider, right? I mean, like that's very rare. Usually the people we attract, they're sophisticated, which means they've been through it. They've been trying other things, which is a good thing, right? Because that means you don't have to explain so much to them. They already kind of understand some of, that healing could be a possibility, that their body could actually get stronger, that there are ways to intervene, especially if they have a diagnosis where there's like no hope, and they've already started to kind of like find hope from other avenues like functional medicine or whatever. You don't have to sell them on hope because they've already started to find it. So it's very good to have patients that are seasoned and sophisticated. The only thing is at that point, you've got to be able to differentiate yourself, because they've tried a lot of things like you. So you have to help them understand how you are different, in fact. And one of the best ways to do that, I find, is having a process. Not just like, here's my supplement, here's my herb, this is the way we look at it, right? Because if you're doing the blind man and the elephant thing, right? Like there's, 3 or 4 blind men or whatever, and each one's got a different part of the elephant. And the one guy's holding the leg and going, oh, it's a tree, and the other one's holding the trunk and going, no, it's a rope, They all have a limited perception. They're all kind of technically right, but they're all missing the point. And we don't want to be one more blind man that the patients are coming to see. And what I mean by that is these paradigms where it's like, oh, everything comes from the gut, man. It's all the gut. The gut is the root of all illness. And then here comes the next one where it's like, no, actually it's like brain development. Like your brain is in charge of everything. The brain is the root. No, it's hidden pathogens. Hidden pathogens are the cause of all illness. Which one is it? Right? Like they're all right, in some sense. So we don't want to be just one more voice, like one more silver bullet voice. At least I don't. I want to be comprehensive and go, it's all of it, right? But then the next step is to not get overwhelmed by the complexity of all of it. So we have to have systems. That's where the clinical clarity comes in. And you go, it is all of it. We're going to actually troubleshoot your body in an order where we're not going to have things falling through the cracks. So if we start with the immune system, right, and we do get the hidden pathogens and the biofilms and the microplastics and the parasites and the heavy metals, and we get all that shit out, right, and the lymphatic drainage is working and the liver's happy, they're sweating appropriately, right, we may find some of the inflammation starts to go down without having to use anti-inflammatory treatments and oppose the body, right? But next, guess what? It is time to heal the gut. It is time to work on those leaky gap junctions, right? We want to tighten those things up. We want to start to heal the tissue, right? You want to use like licorice and things like that protect the lining. You want to start to move through systematically. And we're not done after that. Then we go to the nervous system. That's when we're working on a lot of the brain health and things like that. Then we go to blood circulation, exercise, and we just keep going. The next step is boosting, right? You don't start with like hormone supplementation. That's something that you save for. It's like one of the last ditch efforts is like, okay, I guess we do need to supplement some hormones for you. But you get everything working in the meantime as well as it can so the body can auto-regulate and auto-tonify. Automatically, this is a market differentiator because people are coming to you with all these opinions and perspectives they've gathered up. They've talked to like 50 different blind men, all holding different parts of the elephant. And your job, if you choose to accept it, if you really want to be fucking good at this, is you got to rise above that. You've got to be able to unify all those perspectives. Not everybody's cut out for this, right? And not everybody wants to do it. But if you really want to do it, there's my answer, is be able to unify all the perspectives and use our frameworks, use our order of operations. Because when somebody comes to me and they're like, okay, my functional medicine practitioner's got me on 9 different things. I tried Chinese herbs before, right? And I look at the Chinese herbs and it's like Shaosan or something. I'm like, okay, well, that was stage 3. And I can tell them, okay, here's your supplements that you're taking. These ones go to stage 1. These ones go to stage 2. These ones go to stage 5. You could actually pause all this later stuff, focus on stage 1 for now. Here's the herbs for stage 1. I understand why the herbs you took didn't work because it was out of order. It wasn't time for that yet. You didn't do this other foundational thing, and that's okay because most practitioners have just an understanding where they don't know all this order of operations stuff. And when I got out of school, I didn't know this stuff either. I was doing the basic training stuff, which can work. But for complex chronic cases or anything gnarly, you've got to be able to navigate that order of operations. You got to have the clinical clarity. And when I do that, I put every other therapy, every modality in its place. It's not me with my herb versus the supplement that they're already taking. It's not a competition. I'm integrating what they're doing, I'm organizing it to something that makes sense. And that's a huge intangible value add, where all of a sudden, I mean, they're in your office, you know? So whatever they've been doing hasn't been working to where they want it to be. And when you show up and you're not on the same level as all those things, you automatically are like, oh, well, here's this one goes here, that one goes there. You know, you can probably keep doing the stuff with the functional medicine, that's fine, but just, you know, I would focus on this part of it first if it were me. I'm obviously not monkeying with people's prescriptions, right? But I give them frameworks so that they can have educated conversations with their MDs, right? Like, oh, okay, you know, maybe we should work on the immune system first and then see if some of this other stuff sorts itself out. That's powerful. It just is. All this thing about like, oh, they don't listen to me because I'm just one more voice. Well, you're one more voice on the same level competing with the same types of blind man elephant stuff. So as soon as you can see everything start to come together, and then better yet, be able to communicate that articulately in a way that they understand, get ready, because these people will never leave you. You've shown them something they've never seen, never gotten anywhere else. In a world, honestly, like full of blind men groping at the elephant, and you're somebody who's like, it's an elephant. That's rare, it's amazing, and they will fucking love you forever because you're giving them epiphanies, you're shouldering the burden of complexity, and you have a path forward. And you also can't fake this stuff, which is why I teach it in the program. Like, I want you guys fucking tight with this so that when somebody is like cross-examining you or whatever, you have confidence and integrity around your understanding, and it's at a different level. They feel it. They just feel it. And then they will never not love you for it. It's a whole different way to experience practice and life. All right, I think that's it for this one. Hope it helps. Get to work.